Wouldn't it be wonderful to have a brand new smile in 2018, one that makes you feel so confident? Well, Dr. David Tambor is here to tell us how you can actually get that with mini dental implants. Doctor, thanks so much for being back with us.
It's my pleasure, Tina.
I know we're going to dive into mini dental implants, who it's for, which is going to be a lot of people, but how long have you actually been in practice doing this?
I've been in practice for 32 years and placed our first mini dental implants in 1999. So I think surprisingly for a lot of people, patients and doctors, it's been around for a while. And FDA approved for everything. They're a terrific procedure.
Now, I know when we talk about this, sometimes we talk about how it can replace dentures if you need, all of the teeth done. But I kind of want to focus today on the fact, what if I only have one tooth that needs to be replaced or maybe two teeth? This is still something that could be helpful for those people.
It sure is. And actually, there's a lot more people that are missing one tooth, or two teeth, or three teeth. There are 50 million Americans who wear dentures, so they're missing, but there's way more than that who are missing one or two or three teeth. And conventional implants have been, they're very expensive. I mean, I can't tell you how many people said, I can't afford to do them. And they don't want to do a bridge because that means grinding down maybe other healthy teeth. So mini dental implants are a great option. And you can literally replace one tooth and place a single little post into the gum and into the bone, no surgery. This is a very, very conservative procedure, and then make a crown that fits on there and you get your tooth back.
Look at that.
You can also do it if you're missing a few teeth, and you can just place a few implants in there and make a bridge that fits right on there, and you're not having to grind any of the other teeth. And it looks just like your own teeth. We have shade guides so we can match the color. Because
that was the question I had. I had the question of, well, that one tooth, obviously it's new and shiny, will it look different than the other teeth, but you guys already thought of that.
Yeah, and it's a great question to ask because, of course, particularly if you're talking about a tooth in front, we match the other teeth. We've got shade guides that have 20, 25 different shades, and we can actually custom shade guide it also. So we can, if it's in between, we can pick a color. We can take photographs of it, send it to the laboratories. We can really come very, very close and get these looking very, very natural. And they only take like 2 visits.
That's what I was actually we were talking about how quick this is, and there's no grinding or there's no, so walk me from consultation on. Somebody
comes into the office and they're missing a tooth.
Okay.
Tooth is out already, and we take a look at it. We'll take an x-ray, make sure the bone is good. We don't charge for this. And if the bone is good, then we're able to actually place a mini dental implant directly through the gum into the bone, and then take an impression and have the patient come back a couple weeks later, and we put the crown on and it's done. As opposed to with conventional implants, it can be a 3 or 4 month ordeal waiting for healing and until you can even start to take the impression for the crown. So this is a wonderful, I have young people who've had braces and they were missing like these teeth right here.
Oh, yeah.
Congenitally, and after the orthodontist moved their teeth, and they had spaces, and they had to maybe wear these flippers, a thing that comes in and out, and we were able to just put 2 mini implants in and crowns, and they're fixed, the teeth are positioned, match the color, and they're done. So it's a really, really cool procedure for people. A lot of folks don't want to grind their teeth down for bridges. So
you're telling me it's fast. We were seeing 2 visits and you're done in a very short span of time. It's affordable, much more affordable than the other options. And I know we have, I'm not sure if we've already shown it, but I was going to say the before and after, this is actually what it looks like within, boom, those couple of visits.
Yeah, this is actually 1 visit.
Wow.
Because we can, I have in the office a CAD system where we can fabricate the crowns depending on the case.
Yeah.
We can make them that visit. So sometimes you can not even have to wait for 2 weeks. We can put it in, do the imaging with the CAD system, make the crown and put it in right then and there. That's what we did here.
That's incredible. And I know we've heard from some of your patients in the past where they're like in tears. They're so happy and excited, and they've gone so long not thinking about themselves and not doing for themselves. And they're like, why didn't I do this, before? I'm sure you have many stories like that.
Oh, and also just, why didn't I know about this? Yeah. Why didn't my dentist tell me about this? And I wish all dentists did this. I'm happy to help people, but I really wish this was something that was more well-known and more available for patients all over the place. as it is, there's not many of us who do these, but I'm happy to help people do them.
You know, maybe you should go on the Morning Blend and start telling people, oh, look at there, we're already doing. I mean, that's exactly why you come and sit down with us, because you know this is going to change so many lives. You want to get the word out and let them know you don't have to suffer. You don't have to feel like you don't have a route to fix this situation. And I did say you have many stories that kind of, I'm sure, that you go home and you feel like as a part of your heart. What are some of the ones that have really touched you?
I do. I share these with my wife all the time because they are very touching. I told you about that I've had several young people, teenagers. I had a gal on the other day who just was missing 2 teeth over here, and we did just what I suggested. We placed 2 implants. She came back a couple weeks later, we put the crowns in, and she was crying. She was crying because she thought she was not going to be able to afford to replace these teeth because she had been given a very high quote, and it was also much easier than they thought it would be. It's much less invasive. We're not cutting, we're not coring out a bunch of bone. It's a much, much more conservative and less expensive procedure.
Well, we love to hear tears of joy at the dentist is what we want to hear. Doctor, I'm going to tell everybody how to get a hold of you to start this process and about that consultation that's free again that you were talking about.
Yeah,
but thank you for stopping in.
It's my pleasure as always.
Okay, you guys, that's special for our viewers. Get a complimentary consultation that's including those x-rays. And if you mention the Morning Blend, you get a 10% discount off any mini dental implant case. To schedule your appointment, give them a call. It's at 520-298-6026 or visit TucsonMiniDentalImplants.com.